Does mammogram actually cause cancer?
That's a very common myth. Most of them are very scared because they're worried about pain.
Is there only one type of breast cancer?
There's actually multiple types of breast cancer. The type of breast cancers that are slow growing, so they take a few years to grow from one size to another size. Or there are some that grow very quickly for a lot of HER2 protein, and those tend to be a bit more aggressive. The benefit of having a mammogram.
Hello, Dr. Farhana. So for someone who hasn't heard about you before, how would you describe yourself and maybe tell us a bit about what you do?
Hello, Shalene. My name is Farhana Fadzli. I'm a consultant breast radiologist. I'm currently working in Hospital Picaso. My main interest is in breast radiology, but I also do a lot of general radiology, as well as I report PET-CT under the umbrella of nuclear medicine as well.
How long have you been doing this?
I've been doing this for about 17 years now.
Oh, you started when you were 10?
I wish. After I finished my undergraduate degree, I decided to do radiology. And so I've been doing that ever since.
Is there only one type of breast cancer?
There's actually multiple types of breast cancer. There are different types. So you can look at it at the type of breast cancers that are slow growing. So they take a few years to grow from one size to another size. Or there are some that grow very quickly. So they are the more aggressive type of tumors. So they grow very fast and they also spread very quickly. There are also a different way of classifying the breast cancers in which we look at the hormones, whether they are hormone sensitive or not. As you may be aware, we have estrogen and progesterone hormones in our body. So some cancers are actually sensitive to those hormones. We can actually use specialized drugs that will actually block those hormones to target and control the growth of those tumors. But there are also some other tumors which are related to the HER2 protein. So they have a lot of HER2 protein, and those tend to be a bit more aggressive. But nowadays, with very specialized treatment, it can also be targeted very well. There's another type of tumor, the triple-negative breast cancer. I don't know if you've heard of that. In which all the two hormones and also the protein are all negative. And these tend to be one of the most aggressive types of breast cancer. Yeah, but even then, now with immunotherapy and specialized chemotherapy, there's always good treatment nowadays for even triple-negative breast cancer. And we see a lot of patients doing very well as long as their cancers are detected early.
I see.
Radiologists are the ones who detect the cancer first.
Ah.
And that's usually once a patient comes for screening. So it's very important to make our Malaysians aware about screening programs. So when we are able to detect it very early, maybe via mammogram with early detection of microcalcifications, or sometimes detection on ultrasound of very small tumors, or sometimes some patients had an MRI of their breast and they detect very small lesions or enhancement. So these are the patients who can have the early diagnosis, and usually with early diagnosis comes a good survival rates for those patients. So as radiologists, we are the eyes of breast cancer detection, and so we can help to detect early these cancers and hopefully help them to carry on in their journey through early treatment and hopefully a cure for their cancer as well.
Yeah, because I imagine we hear this tagline a lot, like early detection saves lives.
Yes.
So on that note, I have got a little case for you, Dr. Farhana. Could you share what do you see in these images?
Sure. So these are images of the breast in two views. These are the ones that we normally do for all patients.
So they are the same breast actually?
They are the same.
Ah, okay.
Each breast gets two separate views. Notice in these images that the breasts appear very white.
Yeah.
And this is one of the problems when we are doing imaging for women's breasts. Apart from dense breasts being very white, the cancers also appear white. So it's actually like looking for a snowball in a snowstorm. Yeah, so that's why in most patients with dense breasts, we need to do some complementary imaging. And ultrasound is the most common one. Apart from that, we also now have contrast-enhanced mammogram as well as MRI to help us.
What is contrast?
Enhanced mammogram.
Enhanced, yeah.
It's a mammogram, but with the added contrast, have you heard of CT scans?
Yes.
Most patients who undergo CT scans require some contrast to be injected into their veins to allow better visualization of the organs in the body. So it's a similar thing with contrast enhanced mammogram in order to enhance the view of the breast, especially in dense breasts.
I see. So with that, right, I've heard of some myths before around mammogram. I see your face is like, tell me about it. So does mammogram actually cause cancer or activate the cancer cells?
So that's a very common myth. So mammogram is actually the internationally recognized screening tool for breast cancer. The amount of radiation that you get from a mammogram is quite minimal. Just imagine if you were flying from KL to Tokyo in a plane, you would actually get about the same amount of radiation that you will get from a mammogram.
As human beings, we are already exposed to radiation day to day.
Yes, day to day. We cannot avoid it. Just walking outside in the sun or even staying indoors as well. We are just exposed to radiation all the time. But the benefit of having a mammogram outweighs the risk of this small dose of radiation. So I would recommend that women do come forward to have a mammogram.
And you also mentioned ultrasound.
Ultrasound is more of a complementary technique. It's not a screening tool per se. In younger women, we tend to recommend doing an ultrasound first. So if there was a young lady, maybe in the 20s or 30s, I would usually recommend to do an ultrasound first. And then only if it's necessary, we move on to a mammogram. But those above the age of 40 and also 50s, we would recommend doing a mammogram first.
So say for someone who's watching this episode and they come across, they are 41 years old and they're thinking about to go for mammogram, what would you say to them that maybe they're contemplating, they really want to do it, but just I don't know when I'm going to do it, but I will do it one day. What would you say to them?
So I would suggest that they go and see their breast surgeon first to get assessed, because it's important also for the patient to understand what's their risk of having breast cancer. So in those people who have a higher risk, they would probably be recommended to have the mammogram done. But maybe if their risk was a bit lower and they are a bit more reluctant or very scared to do so, maybe they can just have the ultrasound first, to allay some of their fears. And then can see how it goes from there. Because ultrasound is a non-radiation technique. It has no radiation involved. So it's a very safe technique. Yeah.
I see. Before we wrap, Dr. Farhana, do you have any last word or any take-home message for our audience out there who's watching?
My main take-home message would be come forward for screening of your breast for early detection of breast cancer. It may seem like something scary. You may be worried about having breast cancer in the first place, but early detection is much better than detecting it late. With early detection, there is good treatments out there. There's a wide variety of choices that can be delivered to you. The survival from breast cancer is much better as well if the cancer is detected early. And in Hospital Picaso, we do our best to help you if you have any concerns or symptoms. And we also provide most of the latest treatments that are out there for breast cancer.
Thank you for that, Dr. Farhana. I think what you just said really summarized everything that female would be thinking, especially when they may have felt some symptoms already, some abnormalities, rashes, nipple discharge, all these symptoms, they should definitely get it checked. And otherwise, they should always go for screening. You mentioned from the 20s, it will be ultrasound, and from 40 years old and above, there will be a mammogram. Yeah, correct. Thank you so much. And good chatting with you today, Dr. Farhana.
Yeah, thank you very much, Shirley.
Thank you.
So we haven't makan.
Ya, we haven't makan.